important area, in especially on health, especially countries like India, where the population of about 1.4 billion, and about 600 and 700 million cattle, and about 800 million poultry. So this is a very vast country with different type of cultures and the weather, and it's very difficult to eradicate diseases like rabies. So now, rabies is one of the oldest disease. That history of rabies. It is there in many centuries, and it affects all the warm-blooded mammals, including human being. And recently, you might have seen many of these, papers, and as well as in most of the publications about the sudden spurt in the cases of rabies. This is a kind of big concern for countries like India, where India is now trying to show a progress in most of its the human resources development and social status, and cases like rabies are bringing down the image of India. So what is happening in India, especially with rabies? And they say that India recently faced a sudden surge in rabies with about 14.5 lakh cases reported in the first 7 months of 2022. But it doesn't matter. The government of India is taking a lot of steps, especially the Ministry of Health and Family Welfare. And in fact, they have taken a model of the control of these rabies through this One Health approach. It has been conducted in Goa, because Goa is a state which is very small, and it can be administered very nicely, and they are able to eliminate the rabies in a small state like Goa. So this is the concept is called disease-free zone. This disease-free zone concept has been originally done in diseases like a foot and mouth, which is again a viral disease affecting the bovines. So now, in spite of all these spikes and the government's steps towards controlling, now we are going to see what is the status of the rabies in India. And before that, I want to just warm up all the important information about rabies. Rabies is an important viral disease which affects the central nervous system of all warm-blooded animals like dogs, cats, foxes, etc., including human being. So this belongs to Rhabdoviridae, the genus Lissa virus. So Lissa is a term which is commonly used for the genus, and the virus is normally present in the saliva and brain of the infected animal, and most commonly transmitted by a bite. So it requires a bite, and then the virus get into the system. Though the dogs are the most common mode of transmission of virus, but there are birds like bat, which are very important reservoir in certain regions, especially in countries like US, where the dog-mediated rabies is less, but it is done by these kind of bats. So bats are again important creature in the ecology. So, but they also act as reservoir for so many diseases. One among such is rabies. And this kind of presence of wildlife, variety of wildlife, gives an opportunity, in several kind of opportunity for transmission of this infection to domestic animal and human. So these, in whichever country the wildlife or game is there, the chances of elimination of rabies, the probability of elimination of rabies is very difficult, because in a single host disease like polio, which affects only human being, India has been successful in eliminating. But it is a real challenge for countries like India with different agroclimatic conditions, different regions, the landscaping, with the presence of a lot of wildlife and forests. It will be a real challenge for control of rabies. And this rabies incubation period is also very highly variable. It varies from 6 days to 6 years. It's such a long incubation period, but in average, the incubation period is 30 to 90 days. And it's in 1% cases, it is more than 6 months. And then if it again depending on the site of the bite. So if the bite is near the head, the incubation period is short, because the distance the virus transmits through the nervous system is short, up to 1 month. So if it is bites in the extremities, it will be up to 3 months. So there are so many misconceptions about this virus, people think that all dogs and cats have rabies, because generally, when you see a dog, you are always thinking of rabies. It's not so. Not all the dogs are naturally born with rabies. See, this is a viral infection transmitted to them when an infected dog bite and the saliva enters from the tissue. And they think that, especially those who even rear puppies, because I am a practitioner, many times I get a call, even my 10 o'clock or 11 o'clock, that, sir, my puppy has bitten me, or it has scratched in my skin. So, do I get rabies? So, people always think that these kind of puppies and kittens, younger animals, are more prone for rabies. It is not so, because these puppies and kittens, which are born to immunized mothers, as well as if they are immunized, they are highly safe. So rabies, it's not preventable. They say that we cannot prevent rabies. No, it is completely false. Rabies is 100% preventable, provided you immunize the dogs and cats at the right time. And there are certain kind of treatment they use for dog bite. So as I was telling even to Suchitra sometime before, that in villages people even rub the lime or the slake lime for the dog bite. They will never even go and wash the area or wash with the soap, because the awareness about all these rabies, it's only, most of them are myth. They are not fact. And this rabies has got two critical forms. I think in most of the veterinarians know this. One is called the furious rabies, which we normally see in some of the villages, where it is hyperactivity, and especially in a human being, it is hallucination. And in a paralytic rabies is one we call them as dumb rabies, where the affected dogs will be dumb, and it is usually characterized by paralysis and coma. So these are the two type of rabies clinical forms seen in the animals as well in human beings. And all these Lissa virus, the rabies virus, have the potential to cause rabies. But this rabies virus is the foremost common cause of this infection in human being. This is endemic in all the landmass. Imagine the entire world, except islands like Australia and Antarctica, where the dog-mediated rabies have been less reported. Even US, the dog-mediated rabies has been not reported much. But on the contrary, the bat takes the place. And every year, more than 29 million of people worldwide receive post-bite vaccination. That means they are exposed or they are bitten by a dog. And this affects mostly children between age of 5 and 14, because children, because of their anxiety, curiosity, they go near to any of the dog, because they are very friendly, they love the dogs. So they do not know whether dog is normal or dog is a rabid dog. And the picture on the left side shows how the virus enters into the human the body. See, the most of the time the bite happens at the extremities, in the hands or the legs. So the virus actually replicates in the muscle at the site of the bite. See, that's why when we apply these even immunoglobulins, they apply these immunoglobulin on the area of the bite in addition to the vaccination. And also the virus infect the nerves, especially the peripheral nervous system, and moves by the retrograde transport. And it also replicates in the dorsal root ganglion and travels up in the spinal cord to brain. So this is why when the bite is at the extremities, like legs or hands, it takes up to 3 to 4 months or even up to 6 months to reach the brain, which is the predilection site. And virus travel from brain via nerves to another tissue also. So centrifugally, it also reaches other organs like kidneys, eye, and salivary gland, and thereby the affected person also starts shedding the virus. And this picture is again how the disease is progressing. See, as I told you that generally the rabid, even the normal dog bites, we will normally ask whether you have any broken skin, any small wound, or any kind of a small break in your skin or in the nail. So in such cases, such broken skin or intact mucous membrane, the chances of shedding the virus, entering the virus into the system is very common. Otherwise, it is not that easy. The virus has to be, unless the bite is so deep, it made a small dent in the skin, the virus cannot enter it if you properly wash it immediately. And the virus always also evades the immune response and surveillance. So you cannot detect the virus because they are going in the nervous system. It is very, very difficult to diagnose. and the virus replication occurs, and the negri bodies, which normally we have seen, the most of the veterinary college students have these in negri bodies in the brain. So the clinical signs of the encephalomyelitis begin very later, and then the neuronal transport also sends the virus to other organs like salivary gland, skin, heart, muscles, tongue, etc. But no viremia. You will not see any viremia. That means no virus in the blood, but still the virus is being transported via nervous system to all these organs. So sometimes when these dog bitten is there, when they even feel nothing, they don't feel anything, they think they may negative for rabies. But sometimes what happens, viruses transport through this nervous system and reach the organs. So this kind of the cunning nature of this virus actually causes more fear among the human being as well as in animals. So what are the clinical signs? The clinical signs are almost similar in animals and human. The first 5-6 lines are the clinical signs in the animal, and the symptoms in man the later. If you see, both are almost same. You see the unexplained paralysis or paralysis. So this is very common in the dumb form of rabies, especially when the dogs are not very active. They look like a very dull dog, like comatose. Such dogs might have been suffering from the rabies virus. So especially change in behavior. Normally, for this to find out, whenever any dog is bitten a human being, we normally keep the dog for observation. We call them as UOR, under observation for rabies. So in most of the colleges, in many places, people should always keep the dog which has bitten many people in a place for observation, because if the animal is suffering from rabies, then that the behavior started changing. Say, for example, a playful puppy became withdrawn and became, very, very dull. It won't mingle with the others. So if there is any changes in behavior, that is a probably indication of this neuronal affection with the rabies virus. Or some of the nocturnal animal will come out in the daytime. Say, for example, mongoose, or even bats, which normally don't come in the daytime. So if we start the bats flying, and those bats might suffer from or carry the virus. And pica, this is one of the very common clinical signs in animal, especially. They usually get confused because the younger puppies and cats, because of the calcium insufficiency, they start eating strange things. So many of the pet owners, the pest of the veterinarians, say, my dog is biting everything, whether it has got rabies. So, but this is one of the important symptoms. See, they see the next point, chewing at the site of the bite. So, normally when the dog bites, it bite and leave it. But when the dog bite in a place and start chewing, that means that their neuronal affection due to the virus, and pawing of the mouth. So these symptoms are very peculiar to the dog suffering from, or animal suffering from this rabies. And difficulty in swallowing and altered phonation. These dogs normally howl. See, many times, in India, especially Indians, when they, in the night time, when they hear that howling of dogs in the neighborhood, they say that something bad is going to happen. Because on those days, these howling of dogs represented the rabies. At that time, there is no vaccination at all. So what happened? The howled dog would have bitten so many people in that area, and people might die due to that. So they think that something bad is going to happen in that neighborhood. So there is these are some kind of unfounded information by the people who lived earlier. And bellowing of cattle, and this bellowing of cattle is like if you say in Tamil, adivaithila irundhu very peculiar sound. They make a sound as though they make it from a very hard sound. So if you see cattle bitten by dog and suffering from rabies, it's a very horrible experience. In fact, I happened to see a couple of cattle suffering from rabies. They might have tied the animal within 4 or 5 places all around in the trees, but in spite of that, they make the sound because of their neuronal affection and hypersalivation. And many times I've seen, if you just clap, the animal will go into hypersensitivity. So these kind of features are very peculiar for animals suffering from rabies, because this is very, very critical, because many times people misconcept. They have so many myths about rabies, but they normally miss what is the real clinical signs they should look for. So in human beings also, the symptoms are very similar. Pain or tingling at the bite of site. So this can be felt only by the person who are suffering. So the pain will be tinkling. It will be, kind of, the pain will be recurring again and again at a shorter interval. And difficulty in swallowing. They call them as hydrophobia. So, when they drink the water, any fluid, that, the muscles contracting very fast. So it causes a lot of pain. So it's called fear of water. When you take, there are pictures earlier released on those days, people, especially in government hospitals, suffering from rabies. Somebody might have, see this kind of experience. They'll never ever go near a dog even, because that kind of experience. And this is very critical because of the voice changes. And autonomic instability, for example, either slow heartbeat or hypersalivation. Because of, this neuronal symptom, they make it like instability and change in behavior, exactly like animals, lack of coordination and involuntary movements of the face. The face will be, like moving like without their will. They move like as they feel. And hypersensitivity light, they will not be able to see the light. See, I don't know that I've seen once in the Madras Medical College, these people are kept in a dark room. People who are suspected for rabies bite, they're kept in a dark room because they are hypersensitive to light. And or they will tie a kind of cloth, or they'll apply some dark bandage. And even sound, I told, this hypersensitivity or even touch. So these are all very typical symptoms in human being. And aerophobia, even if the air comes, they think that somebody is coming. They are always thinking about, that kind of neuronal changes. So aerophobia and muscle twitching, paralysis. So these are all the symptoms which are very similar, both in animals as well as in human beings. So this is a list of animals which are transmitting rabies in India. I mean, this is actually a report provided by the West Bengal University. So they have done some work, and it's like, most of the domestic animals like dogs, cats, and wild animals like foxes, jackal, monkeys, mongoose, bear, and peridomestic animals, which are, which goes to forest and, then come back. So those, some of the animals which goes to on migration on a daily basis, or some of the animals go on, they stay for a few days or a couple of weeks and then come back. So like cows and buffaloes, sheep and goat, donkeys, horses, camel. And India, there are not much of reports of bat or rodents or even birds or squirrel, because many times people say that, these whenever you are bitten or you are hit by a bat or rodent, you will have always a doubt. So these comes under category 3. That means you need not vaccinate for post-exposure. So now, why that One Health approach is needed for control of rabies? There are so many kind of controlling methods. Why One Health? Because I told you that rabies is a disease caused by the animals, and it caused by the biting in human beings or other animals. But where comes the other sectors? Say, for example, if you don't keep the environment clean or neat, if you are not properly disposing the offals and the food waste, these dogs will not roam around. See, in most of the Western countries and countries where high status, that the environment is kept clean. That is one reason that these kind of dogs, the stray dogs or the community dogs, won't wander. And also, there should not be any kind of disturbance to the environment. Say, man think that he is the only living thing in the world. They never bother about the forest areas or areas which belongs to them. See, many times we see in the television and radio that, so many elephants are hit by train. See, the elephants are going in their corridor. We built a railway track and they are crossing. So, these kind of sectors, unless the cooperation of all these people, especially the veterinarians, the human health sector, and even the environmental, especially, of course, this is an example in the government of Nepal, but, there are so many other non-governmental organizations. In India, especially in other countries also, there are many non-governmental organizations involved in the control or creating awareness about rabies. So, with the cooperation and coordination of the different sectors like the veterinary, the animal husbandry, or the medical department, the public health, the environment, the forest official, even civic authorities. So, without cooperation of all these sectors, it is very, very difficult to control the rabies, because rabies is not occurring on its own. It is bitten by a dog, and the dog will be bitten by some other dog. So, no, unless everybody coordinate with each other, the control of this disease is very difficult. And the concept of theme of this One Health this year in September 28th was One Health, Zero Death. That means that we have to see that there are no more deaths due to rabies by following the One Health approach, especially for controlling the rabies. So once this single sector can eliminate rabies, definitely it cannot. I told you the coordination of the different departments are needed. And COVID-19 pandemic taught us a lesson. We have never seen the lockdown in our lifetime. Even our elders have not seen, but we have seen the COVID-19 pandemic. The entire city was locked. It was cordoned off. No buses. See the policeman standing and directing. See the pandemic, COVID-19 pandemic, every department, every sector was involved. Otherwise, imagine this COVID-19 pandemic could not have been controlled like this. So this dog military rabies also has similar kind of coordination. And in fact, they have done a kind of small study, as I told you earlier, the Goa they have done. So where they were able to reduce the human death to 10 times lesser, and they even made a rabies control area. I was telling, disease-free zone. So this was brought by the coordination of veterinary, human, civic authorities, public health volunteers, public volunteers, and also capacity building of the state lab for rabies. Now, if you want to diagnose rabies, there are few laboratories in any place. Even in Tamil Nadu, in Chennai, there will be a handful number of laboratories doing the diagnosis. So, if somebody has got some doubt or clarification, where they will go? So, we do not have a laboratory for diagnosis. And compulsory vaccination of all dogs. This is very, very critical, but it's easy to say than done. Imagine that, in India, I think this situation is very critical. All of you should accept, you'll accept that the dogs which are seen in the streets, we call them the community dogs or street dogs. Who owns that? Nobody. Nobody owns that, because it's a community dog, as the word goes by. But if the dog bites someone, who will be responsible? Nobody will be responsible. So these street dogs or community dogs are a kind of partially owned, and that is another reason. Of course, these are all the kind of social status prevailing. This has to be changed. This has to be modified. And also, when you bring a dog from other place, say other towns or other country, even other states, there should be restriction. Those dogs should be compulsorily vaccinated. They should be kept, or they should be even tested for presence of antibody titer. So I told that there are laboratories in India, Tamil Nadu, in all states for diagnosis. Those kind of bringing dogs and testing the dogs for rabies and bring it to the society. So this is very important, and inclusiveness of this rabies awareness in syllabus, even in school children. So this they have done it in Goa. So there is an organization called International Rabies Task Force, which has done this in Goa. They have developed a mobile app. You can see on the right side. So Goa is a small state. They are able to successfully do that. But when you are doing it large scale, definitely there will be a lot of problems. And I will also bring some of the statistics related to rabies. So, there are about 55,000 deaths every year, and this mostly occurs in Asia and Africa, because as I told that the street dogs or community dogs are partially owned. There are no owners. They move around and nobody owns that. And India accounts, unfortunately, for 36% of this world's rabies death. They say it around 80 to 20,000, but this is only in WHO. In Government of India websites, they have recorded less number because they have a state-wise record of the deaths. And the dog vaccination coverage, this is very critical. See, we have close to 35 million dogs in India, because I did a project on dog filariasis. Fine. We had even see the coverage of dog population in various places. We had close to 18 million the stray dogs and about 12 million owned dogs. See, even among the owned dogs, see, the coverage is not that great. So we should first implement 100% vaccination of all the dogs, so that we are making the dog protecting against rabies. So now India has started the national rabies surveillance scheme as well as control program. So if this is happen, I think the prevalence will come down. So this is the rabies death per capita, say per 100,000 per 1 lakh population. This is conducted. The country shaded in gray, you can see the entire North America and then Australia. There are no dog-mediated rabies, I told. So they do have rabies. Even US have rabies, but through the bats and say like mongoose or other animals, not from dogs. Because 100% the dogs are owned by owners. This is pet owned dogs. So they are vaccinated, they are covered, they are monitored. In other countries, imagine about these African countries and Asia, especially the Indian subcontinent, the peninsular India, where India and other countries, they are recording more. Probably because of our kind of social attachment with these canines. And this kind of awareness will probably bring in more and more people into vaccination. And this is a species-wide cumulative rabies cases for the past 17 years. You can see the cattle, the one in the yellow, because cattle which goes for grazing, they're attacked by the dogs. And of course, dogs and cattle are the most common, followed by even horses, buffalo, because cattle and buffalo always, in the villages, they are prone for this kind of bites. So these are very common, especially because these are when they go for grazing, they are taking water, or especially the stray dogs, the community dogs are the etiology for this. And this is the rabies prevalence data, including the death in the Indian states. The one in the red, which is the data from 2005, this is taken from the Government of India website, and the other one is the data from 2012 to 20. So this is given by one Central Health Intelligence, is part of the Department of Health and Family Welfare, Government of India. You can see the central part of India, I think looks like Telangana and earlier Chhattisgarh. So these are the states where, maybe the geographical area of that, this is unoccupied. Those are, kind of villages are, not habited by human being. So those areas may have many kind of stray dogs or feral dogs. So they might cause more kind of rabies in those states. And of course, this is only per 1,000. See, this is a proportional rabies mortality in India from 1991 to 2005. So this is per 1,000. The numbers look less, but because our population, this looks nothing, because we have 1.4 million 1.4 billion human population, and this is again clinically suspected cases. But though the clinically suspected rabies cases coming down, the recently, for the recent past, maybe for the past 1 or 2 years, there are more news on this kind of rabies prevalence or death or bite. This is probably, I would say that because we had we interacted with the Public Health Department for some other context. They were telling that nowadays, the waste disposal, the problem is these are all happening in urban as well as semi-urban areas where the disposal is not proper. So there are so many places, even if you go around any cities, if you see the suburban areas, there will be pile up of all these wastage, especially biomedical or in a garbage. So naturally, these are all ideal place for these kind of feral dogs to breed. They wander, and even if one suffer, it naturally get bitten by other dogs. And so it's due to it is growth. We can say it is due to growth, but it is not a planned growth. And what is the impact of this the canine rabies? So in addition to the deaths, naturally, it is not the death, and it affects the human's ability. Say, for example, if 29 million people are exposed to vaccination, so their ability to do their regular job, or they might have applied, they may not go to work. So 29 million is a huge number, and people are also averse towards these canines, and and it also causes the there are people even in some of the neighboring states in India, that we saw that people started attacking the dogs because they think that these dogs are causing us the rabies. No, they started killing. They are not the reason. We are not them. We have not protected them properly. So they are even killed by some of these people who do not understand the biology of this infection. And then there are conservation threats. See, there are many wolf and African dogs. When when some of these infected dogs roam around and bite, and these dogs die on their own. The infection spread within the forest, and how difficult it to go into forest and vaccinate all this. And though we have this baitable rabies vaccine, that is not so successful. So these also cause conservation, because some of the breeds which the numbers come down. And but luckily, countries like India has got lots and lots of non-governmental organization from the United Nations, like the World Health Organizations, the World Health Organization for Animals called OAE or FAO, and there are so many private organizations, NGOs. They're fighting for creating awareness, and they are giving this mass vaccination program, and also we are teaching the students. They're creating awareness. But in spite of all that, they don't take the first medical care, or they don't go for vaccination. So that is where the death still is occurring in rabies. So it emphasizes that the holistic approach for control of rabies is very, very critical, and it involves, as I told you, there are many factors. So socio-cultural. See, people still not aware, and community has to involve. As I told you, if there are 15, 20 dogs in a village, who cares? See, the community should take care of the dogs. They should take it to hospital, get it vaccinated regularly, and responsible dog ownership. Many times we see people, even in cities, this is very common. Even in our apartment where I stay, we have close to 200, 300 dogs, and some of the owners, they won't have that, control the dog. They just take it for walking. If it goes, and they won't bother. So the owning is not important. They have to do it responsibly. And when there is suspect bite, you should always go for treatment. And post-exposure prophylaxis, many of the people do not go, because people are not aware of what are the vaccines available and where it is available. Even we had our own experience recently. There was an incident, and we really do not know which hospital in Chennai has anti-rabies vaccine post-exposure. Even we were not aware, because there is no information. Whom will you ask? You cannot ask anywhere where you get all this. Though they say all the government hospitals are supposed to keep this vaccine, but this is all only presumption. And organization. See, there is no single organization which will control or prevent rabies. For example, in fact, I did a small project on contraceptive vaccine for dogs. So we were also trying to combine the rabies along with the contraceptive vaccine, and we approached two organizations. One is Chennai Corporation, another is Bluegrass. So Chennai Corporation said that when you have this rabies vaccine, you also give this contraceptive vaccine. But see, even for corporation, who will fund? See, the Chennai has got close to maybe 100,000 or 200,000 dogs. So these dogs has to be vaccinated at least once. So the cost of maintaining the antibody titer in dogs is very critical, and it should be done in a harmonized manner. How will harmonize? Because when you vaccinate a dog and leave it, it will go. Of course, it will live in the territory, but to track the dogs again the next year. So these should be done in a coordination between veterinary, civic authorities, and public, the community engagement. And how will you monitor those dogs are got antibodies? There is no system. There is no surveillance system. And political will. So this is very, very critical. See, in our country, it's mostly knee-jerk. See, if anything happens, the government will come into the picture, do anything. But countries like India, it's very difficult. I am not blaming government, but it is they have to plan, especially well in advance. Bring the coordination of the different departments, animal husbandry, medical, civic authorities, community. So imagine, this is a very tough task. This is not a easy task, but there should be a political will to control to frame a legal framework, and then they have to demonstrate it. So for example, state like Goa, when they can control, they can start with some kind of city. Say for example, Chennai or Coimbatore, we will make it rabies free. So this is very, very critical, and this rabies control elimination, it is a very, very tough task unless there's a holistic approach by different sectors, different domains. So it needs, vaccination. They need money. They need logistic. They bring the vaccine store. They need veterinarians. They need diagnostic lab to test whether the vaccine has got immune response. The surveillance and technical support, veterinarians, medical doctors, and if they have a system in place, they should know whether it is working or not. So these are all the kind of approach which is needed. Very, very critical. It is at least, countries like India can do it because we have so much of resources. And so this is a conceptual framework on controlling human rabies. See, this is a picture again from a published literature, nothing new. But like the green lines are the risk reduction. So these are the steps. Say, for example, if you properly vaccinate all the stray dogs, if the rubbish, I told her the wastage, now they found that the improper disposal of the wastages in and around cities are one of the main reasons for increased rabies. We can't believe, but that is one of the reasons. See, you have rubbish everywhere. So all these dogs have access. They come out. They wander in the streets. So these kind of risk reduction has to be done with holistic approach. And then the red lines are risk factors. See, when they are prevalent in domestic animal or when they are not properly vaccinated, naturally they are prone for the human, especially the wildlife. If they suffer from, wildlife is again a completely, nobody can go and vaccinate wildlife for rabies. How? It's very difficult. So, unless these risks are assessed properly and then controlled, it is very difficult. So that's why I told in the first that viruses like polio, which is single host, can be eradicated very easily. But rabies, which can come from the wild to domestic and domestic to human, it is very difficult. But holistic approach, One Health approach, definitely will help. And these challenges, the same thing I told, that prevention of canine rabies and dog population management. See, the government is doing the ABC, the animal birth control, regularly, but still, many of the dogs, for example, in a small community, say about 50 dogs are there, unless you birth control done in all the dogs or all the males, the female will not conceive. But if you partially do, and one dog will be enough to again increase the population. And the knowledge, attitude, practices of communities. So this is where the problem. And the paramedic staff and veterinarians, I told you that in villages, they apply the lime, slacked lime for rabies. There's so much is happening, but they do not have anything on the village. So the attitude should change. And we should increase the awareness as done in Goa. The school students should be aware of what are the post-exposure, how to do the post-exposure rabies. And disease surveillance and diagnosis, this is very difficult, but this has to start somewhere. The state should have at least this kind of surveillance at district level. And more than that, the coordination of all these stakeholders. So these are all the strategies for the challenges given on the website. So One Health is a very good option, which can definitely bring all the sectors and bringing the community and the government and the technical people. So if the three they work together, they can definitely bring down the rabies. And I also given some of the information because this is very important, very critical, because this awareness is very important for everyone. And what are the pre-exposure prophylaxis, especially who are the target people who has to be vaccinated regularly even before exposure? The veterinarians, the laboratory personnel who are dealing with suspected materials from dogs or virus, or medical or paramedical personnel treating rabies patients. And dog catchers, especially the working in civic authorities, zookeepers, the pound workers, postman, policeman. So these people have got occupational hazard. They are all, especially school children. See, the rabies is very common, the age between 5 to 14. And wound management is very critical. This is very, very important. Many times people will do first mechanically, you have to wash them running tap water. This is very, very critical because the virus will get washed if properly wash it in a running tap water. That means at a force. Chemically, you can apply soap or even detergent powder or disinfectant like povidone or spirit or even any household antiseptic for that matter. And biologically now, immunoglobulins are available. I'll show later some of the immunoglobulins available in the market. But there is no single directory or the place where you will know how many immunoglobulins are available, where available, what is the cost. So that is all we are still unaware. We should not apply irritant, don't cartridge, don't touch the wound with the bare hands. And of course, tetanus toxoid can be given especially for cities like Chennai where had a lot of equine population earlier. And rabies immunoglobulin, they are very critical, very important. Many of us may not be aware that we have so many companies which are manufacturing in India, both from the equine as well as human. The immunoglobulins are basically from equine or from human. The ERIG is from equine rabies immunoglobulin, HRIG is human. And now with all these animal ethical, now it's very difficult to get. Only few companies produce this equine. So these dose rate is 40 international units. The most of them provide very high dose. This is available in most of the cities. So immunoglobulins can be immediately applied. And this is very effective and administered locally. And it should be, it should be done. It should be infiltrated, possibly in the depth around the wounds and the bite place. And this should be also given as a deep intramuscular, but it should never be given intravenous because this is basically immunoglobulin. It will immediately result in shock. And there are three categories of post-exposure bite. The category one is very common. Normally, some of the dogs will, while we are feeding, it may leak. So it's nothing to worry. So no need for vaccination if they are properly immunized. And then they may scratch or nibble an uncovered skin. And that came, you can apply wounds. So you can wash, you can apply some antiseptics, and then you can give anti-rabies vaccine immediately. And the category 3, this category 2 is very common normally, and category 3 is bite, the single or multiple transdermal bite. This is where you have to be very careful, especially if it is close to any mucous membrane. And any chances of licking by the saliva, infected saliva, this is very critical. This has to be given post-exposure vaccination. So these are the rabies immunoglobulins commercially available in India. They're all manufactured in India. You can see the Behring, Sanofi, and Kamada. These are all. There are so many immunoglobulins available in India. These are all India make. We have this CRA, Kausoli, and Bharat Serum, even Indian Immunologicals, Hyderabad. So there are plenty of immunoglobulins available. And post-exposure, this is very commonly, if everybody has got out, 5 vaccinations be given, 5 vials. So day 0, day of bite, 3, 7, 14, and 28. So this is very important. On day 1, in addition to vaccination, even rabies immunoglobulin can be given. And of course, these are the diagnostic tests available for rabies. And this is very critical, especially when you're importing dogs or, when you're bringing new dogs, when you suspect, when you're having some dog, you want to make it sure it is not suffering from rabies. You have any antibodies. This is to see the antibody level of rabies. So one is called REFIT. In fact, I think Tanuvas, they are doing this. They are doing it in Department of Animal Biotechnology. And FAT, which normally it can be done in the fluorescent microscopy. So these are the 2 assays done for diagnosis. And so what is next? What next is? Now the researchers and policymakers along with community, they have to join and promote evidence-based policymaking. And the landscape of rabies control is very complex. It's not that easy. With actors from multiple sectors, I told animal welfare, public health, veterinarians, civic administration, medical doctors. They have to work together so that they can bring down the case and awareness. And one size may fit, because whatever you have done Goa, it may not fit to other states. Because Goa is a kind of small state close to, coastal areas. States like Karnataka, Kerala, Tamil Nadu, they have mountains, they are hills. And One Health approach with an interdependence, like, It should be dependent, human, animal, environmental. So multiple department domains should come together. So this is the only option available for eradication or elimination of rabies. So we need more epidemiological studies and implementing research at a wider sector of actors, because though that there are many work done in rabies, antibodies, but there is no a systematic complete study on the antibodies in vaccinated dogs or in the feral dogs. So the first recognition of the complexity of the rabies control, this is very, very important. So susceptible, they have a policy which is effective, acceptable. Whatever policy we develop, if people are not accepting, there is no use. Should be developed and for affecting bringing the zero death. So One Health is the best option for zero death due to rabies. So this is the emphasis for bringing the One Health. And rabies is 99.9% fatal. No doubt, it is 100% fatal, but 100% is preventable if you are vaccinating the dogs and other animals. And the next point is promptly seek the medical attention. Unless you seek the medical attention in time and guidance from a physician, we are at risk. So immediate medical attention. This is where most of the cases, especially in villages, they lose. And they get the medical care and rabies biologics. Biologics may not be available in the nearby, maybe in 100 kilometers, 50 kilometers. Now there are immunoglobulins indigenously made available in major towns and cities. So if you put the post-exposure along with the immunoglobulins, we can save. That's why 100% preventable. Of course, that is treat. But though it is 99.9% fatal, it is preventable if you properly vaccinate, especially not own dogs, even the community dogs. So you be aware and end rabies now. So the stress here is One Health approach is very critical and needed for zero death in rabies. So I would like to thank the Kairos Kinetic and the GBR Foundation and Savita Dental and University for providing me an opportunity to briefly tell about rabies. This, because rabies is a kind of, it's an ocean. This is a very important disease affecting community, and especially for countries like which have so much complexity. But awareness is very, very critical, and then the cooperation of all these sectors. So with this, I